HESI A2 Anatomy and Physiology Cardiovascular System. Introduction to the Cardiovascular System. Welcome back to our HESI A2 Anatomy and Physiology series. In this video, we'll explore the cardiovascular system, your body's transportation network that delivers life-sustaining materials to every cell while removing waste products. By the end of this video, you will be able to describe the function of the cardiovascular system, identify the structure of the heart and major blood vessels, explain blood flow through the heart and body, understand the cardiac cycle and electrical conduction system, recognize the components of blood and their functions, discuss common cardiovascular disorders. Overview of the cardiovascular system. The cardiovascular system, also called the circulatory system, consists of three main components working together. System components. Heart muscular pump that drives blood circulation. Blood vessels network of tubes carrying blood throughout the body. Arteries, veins, and capillaries. Blood fluid tissue transporting materials throughout the body. Primary functions. Transportation delivers oxygen, nutrients, and hormones to cells. Waste removal carries carbon dioxide and metabolic waste away from tissues. Temperature regulation distributes heat throughout the body. Immune protection transports white blood cells and antibodies. Acid-base balance helps maintain proper pH levels. Clotting prevents blood loss through hemostasis. Anatomy of the heart. The heart is a four-chambered muscular organ about the size of your fist. Heart chambers. Upper chambers, atria. Right atrium receives deoxygenated blood returning from the body. Left atrium receives oxygenated blood returning from the lungs. Lower chambers, ventricles. Right ventricle pumps deoxygenated blood to the lungs. Left ventricle pumps oxygenated blood to the entire body. Key features. Left ventricle has thickest wall, works hardest. Heart wall consists of three layers: epicardium, myocardium, endocardium. Septum separates right and left sides. Located slightly left of center in chest cavity. Heart valves and their functions. Heart valves ensure blood flows in the correct direction and prevent backflow. Atrioventricular, AV, valves. Tricuspid valve, between right atrium and right ventricle. Has three flaps, cusps. Prevents backflow into right atrium. Mitral, bicuspid, valve between left atrium and left ventricle. Has two flaps. Prevents backflow into left atrium. Semilunar valves. Pulmonary valve, between right ventricle and pulmonary artery. Prevents backflow from pulmonary artery. Aortic valve, between left ventricle and aorta. Prevents backflow from aorta. Valve operation. Open when pressure behind them exceeds pressure in front. Close when pressure reverses, creating heart sounds, lubed up. Blood flow through the heart. Blood follows a specific path through the heart that ensures efficient oxygenation. Complete circulation path. Deoxygenated blood returns to right atrium via superior and inferior vena cava. Right atrium contracts, pushing blood through tricuspid valve into right ventricle. Right ventricle contracts, pushing blood through pulmonary valve into pulmonary artery. Blood travels to lungs for oxygenation and carbon dioxide removal. Oxygenated blood returns to left atrium via pulmonary veins. Left atrium contracts, pushing blood through mitral valve into left ventricle. Left ventricle contracts, pushing blood through aortic valve into aorta. Aorta distributes oxygenated blood throughout the body. This cycle repeats approximately 70 times per minute at rest. Systemic versus pulmonary circulation. The cardiovascular system includes two interconnected circuits serving different purposes. Pulmonary circulation. Purpose: gas exchange in the lungs. Path: right ventricle, pulmonary artery, lungs, pulmonary veins, left atrium. Key features: carries deoxygenated blood away from heart, unusual for arteries. Low pressure system. Short distance circuit. Systemic circulation. Purpose: deliver oxygen and nutrients to body tissues. Path: left ventricle, aorta, body organs, vena cava, right atrium. Key features: carries oxygenated blood away from heart. High pressure system. Long distance circuit. Includes coronary circulation, heart's own blood supply. Both circuits work simultaneously with each heartbeat. The cardiac cycle. The cardiac cycle describes the sequence of events during one complete heartbeat. 3 phases. 1. Atrial systole, atrial contraction. Atria contract simultaneously. Blood pushed from atria into ventricles. Ventricles fill completely. AV valves open, semilunar valves closed. 2. Ventricular systole, ventricular contraction. Ventricles contract simultaneously. Blood pushed out to lungs and body. AV valves close, loop sound, semilunar valves open. Pressure in ventricles exceeds pressure in arteries. 3. Diastole, complete relaxation. All chambers relax. Ventricles fill with blood from atria. Semilunar valves close, dub sound. Preparation for next cycle. Cycle duration. Complete cycle takes about 0.8 seconds at rest. Heart rate determines cycle frequency. Electrical conduction system of the heart. The heart has its own electrical system that coordinates contractions. Conduction system components. 1. Sinoatrial, SA, node. Located in right atrium wall. Natural pacemaker of the heart. Generates electrical impulses 60 to 100 times per minute. Sets heart rate. 2. Atrioventricular, AV, node. Located between atria and ventricles. Delays impulse transmission. Allows atria to empty before ventricles contract. 3. Bundle of HESI. Conducts impulses from AV node to ventricles. Divides into right and left bundle branches. 4. Purkinje fibers. Distribute impulses throughout ventricular muscle. Ensure coordinated ventricular contraction. Electrical activity. Creates the heartbeat rhythm. Can be measured by electrocardiogram, ECG/EKG. Abnormalities can cause arrhythmias. Types of blood vessels. Blood vessels form an extensive network adapting to their specific functions. Arteries. Function: carry blood away from the heart. Structure: thick, muscular walls to withstand high pressure. Features: most carry oxygenated blood, except pulmonary artery. Can constrict or dilate to regulate blood flow. No valves needed due to high pressure. Veins. Function: return blood toward the heart. Structure: thinner walls, larger lumens. Features: most carry deoxygenated blood, except pulmonary veins. Contain one-way valves to prevent backflow. Rely on muscle contractions and breathing to assist flow. Capillaries. Function: site of gas, nutrient, and waste exchange. Structure: single layer of cells, extremely thin walls. Features: connect arteries and veins. Allow materials to pass between blood and tissues. Found in all body tissues except cartilage and cornea. Blood composition and functions. Blood is a complex fluid tissue with multiple components serving different functions. Plasma, 55% of blood volume. Liquid portion of blood. 90% water, 10% dissolved substances. Transports nutrients, hormones, waste products, and proteins. Formed elements, 45% of blood volume. 1. Red blood cells, erythrocytes. Most numerous blood cells. Contain hemoglobin protein that carries oxygen. Biconcave shape increases surface area. No nucleus, live about 120 days. 2. White blood cells, leukocytes. Part of immune system. Fight infections and foreign substances. Include neutrophils, lymphocytes, monocytes, eosinophils, basophils. Much less numerous than red blood cells. 3. Platelets, thrombocytes. Cell fragments involved in blood clotting. Stick together to form plugs in damaged vessels. Release chemicals that promote clotting. Essential for hemostasis. Hypertension, high blood pressure. High blood pressure is often called the silent killer because it typically has no symptoms. Blood pressure basics. Measured as systolic/diastolic, e.g., 120/80 mmHg. Systolic, pressure when heart contracts. Diastolic, pressure when heart relaxes. Classification. Normal, less than 120/80. Elevated, 120 to 129 systolic, less than 80 diastolic. Stage 1 hypertension, 130-139/80-89. Stage 2 hypertension, 140/90 or higher. Risk factors. Age, family history, obesity. High sodium diet, lack of exercise. Smoking, excessive alcohol use. Stress, diabetes, kidney disease. Health effects. Increases risk of heart attack, stroke, kidney disease. Damages blood vessels throughout body. Can lead to heart failure and vision problems. Management. Lifestyle changes, diet, exercise, weight loss. Medications when necessary. Regular monitoring and medical care. Coronary artery disease, CAD. CAD occurs when coronary arteries that supply the heart muscle become narrowed or blocked. Pathophysiology. Atherosclerosis, buildup of plaque in artery walls. Plaque consists of cholesterol, fat, calcium, and other substances. Gradually narrows artery lumen, reducing blood flow. Can rupture, forming blood clots. Risk factors. Modifiable, smoking, high cholesterol, hypertension, diabetes, obesity, sedentary lifestyle. Non-modifiable, age, gender, family history, genetics. Symptoms. Angina, chest pain or discomfort during exertion. Shortness of breath. Fatigue. Some people have no symptoms until heart attack occurs. Prevention and treatment. Heart-healthy diet low in saturated fat. Regular exercise and weight management. Smoking cessation. Medications, statins, blood thinners, blood pressure medications. Procedures, angioplasty, stent placement, bypass surgery. Heart attack, myocardial infarction. A heart attack occurs when blood flow to part of the heart muscle is completely blocked. Causes. Blood clot in coronary artery, most common. Usually occurs where atherosclerotic plaque ruptures. Spasm of coronary artery, less common. Warning signs. Chest pain or discomfort often described as pressure, squeezing, or fullness. Pain radiating to arm, neck, jaw, or back. Shortness of breath. Nausea or vomiting. Cold sweats. Lightheadedness. Important notes. Symptoms may be different in women, older adults, and diabetics. Some heart attacks are silent with minimal symptoms. Time is critical, time is muscle. Treatment. Emergency, call 911 immediately. Medications, clot busters, blood thinners, pain relief. Procedures, angioplasty, stent placement. Rehabilitation, cardiac rehab programs. Prevention, lifestyle changes and medications. Stroke, cerebrovascular accident. Stroke occurs when blood supply to part of the brain is interrupted or reduced. Types of stroke. 1. Ischemic stroke, 87% of strokes. Blood clot blocks artery to brain. May be due to clot forming in brain artery or clot traveling from elsewhere. 2. Hemorrhagic stroke, 13% of strokes. Blood vessel in brain bursts. Causes bleeding in or around brain. Often related to high blood pressure. Risk factors. High blood pressure, diabetes, heart disease. Smoking, excessive alcohol use. Age, family history, previous stroke. Atrial fibrillation, irregular heartbeat. Warning signs, FAST acronym. Face drooping. Arm weakness. Speech difficulty. Time to call 911. Treatment. Ischemic, clot-busting drugs, mechanical clot removal. Hemorrhagic, control bleeding, reduce brain pressure. Rehabilitation, physical, occupational, and speech therapy. Prevention, control risk factors, medications. Key takeaways. Let's review the essential concepts from this module. The cardiovascular system consists of the heart, pump, blood vessels, transport network, and blood, transport medium. The heart has 4 chambers with valves ensuring one-way blood flow. 2 circulation circuits. Pulmonary, heart left-right arrow lungs for gas exchange. Systemic, heart left-right arrow body for nutrient/waste exchange. The cardiac cycle includes atrial systole, ventricular systole, and diastole. Electrical conduction system coordinates heartbeat through SA node, AV node, and conducting fibers. Blood vessels include arteries, high pressure, away from heart, veins, low pressure, toward heart, and capillaries, exchange sites. Blood components include plasma, red blood cells, oxygen transport, white blood cells, immune function, and platelets, clotting. Major cardiovascular diseases include hypertension, coronary artery disease, heart attack, and stroke. Prevention focuses on healthy lifestyle, proper diet, regular exercise, no smoking, stress management. Thank you for watching. You now understand how the cardiovascular system serves as your body's vital transportation network, delivering everything cells need while removing what they don't. Remember that the cardiovascular system you've learned about today works intimately with the respiratory system we'll study next. Without oxygen from the lungs, the heart's pumping would be meaningless, and without the heart's pumping, the lungs couldn't deliver oxygen to tissues. Keep building these system connections as you prepare for your HESI A2 exam. See you in the next video.